welcome to Speak Your Mind. I'm Luisa Toranga. Good to be back with you. Now, has your child been immunized with the Mensi vaccination? Well, the national campaign rolled out earlier this month, and to share more about it with us in studio, Dr. Maisema, the subdivisional medical officer. I'm really interested in finding out more about the vaccination. But before we go into that, Dr. Maisema, if you can just tell us more about meningococcal, if you can just simplify it. You know, some of us are still quite confused with what exactly it is.
First of all, thank you very much for the invitation. The question that's been asked by the community, where did this disease come from?
Right.
And, how come it's spiked up this fast?
Right.
And we've raised this much concern. But this disease has been around Fiji, since for a long time. It's always been in Fiji. But before 2016, it's always very rare. It was rare, And until 2016, we started to see an increase in number of cases. In 2016, we had 29 cases. In 2017, we had 48 cases. And from January this year to April 22nd, we've already had 58 cases. So basically, meningococcemia or meningococcal disease. Meningococcal disease has two components. Right. The first component is meningitis. It's basically the infection of the lining of the brain or the covering of the brain. So the bacteria or the germs, everyone understands the germs. The germs is found in a saliva of an infected person, and then that saliva has to be projected to another person, and then, they breathe it in, and then it tracks up, and it reaches the brain, and then it causes an infection of the lining of the brain. And then in severe form, when the same bacteria reaches the blood, then they have meningococcemia. So we have meningitis and meningococcemia. Both of it are, they are part of the meningococcal disease. And, it's a very dangerous disease. That's why, 48 last year, and we saw the rate of numbers this year. We had to do something very fast. Yeah.
What do you think caused the increase in cases?
Well, there must have been the literature of these bacteria. The other bacteria can cause meningitis. Yeah, but Neisseria meningitidis, that's the cause, that's the name of this bacteria. Yeah, it's always been the two of the main bacteria that causes meningitis. Our children are already immunized. It's in the schedule. Okay. They've been immunized in the first 1.5 years. Okay. They are immunized along those years. But we've never had immunization for Neisseria meningitis because it was rare. It's very rare to get an infection from this bacteria until now. But normally, in 10% of the population, this bacteria lives in their throat, what we call normal flora. But to cause the disease, it needs to reach their blood. So it would have been some exposure, how do you get the disease? If it's just coughing, sneezing, everyone is coughing and sneezing. There's a flu outbreak in Fiji. But, you need to have, one, frequent exposure to the infected person, and then two, just to get a lot of dosage of the bacteria to get that disease, so that they can actually show the symptoms of the disease.
Okay. When you talk about vaccination, the campaign rolled out earlier this month.
Yes.
So how many children? What types of vaccination was given?
So, we've been giving the two that I've mentioned. That's already the pneumococcal and the Hib. That's already part of our schedule that our children are receiving from 1 year, from birth till 1 year, 6 months. Along that period, they receive those immunizations that protects them from those bacteria or from those germs. But for this meningitis, so to tackle something, you need to understand it.
Right.
So for 2016, 2017, what Ministry of Health has been doing, they've been studying this disease. Right. What's our trend, what's our data here in Fiji, and then we see what's the data in other countries who've had an outbreak of this disease, and then with consultations with WHO, and these are experts. They are experts of these diseases. It's in this year alone, the 58 cases are all from 1 to 19.
Oh,
yeah,
1
to 19. But the death, we've had 4 deaths this year, all within the age of 0 to 5 years old. So, but if you look at the data this year, and if you look at from 2016 to this year, and then if you look at the data from other countries, and then again, through a lot of consultation and teleconference with other countries, it was decided that the ones that are high risk, obviously, are 1 to 19. So which means if we protect this 1 to 19, they can automatically protect the rest of the Fiji population. So this MENSI program is specifically for 1 to 19-year-olds.
So the age group 1 to 19, is it because of the risk? The risk is there because of the behavior? Like, I wanted to ask you something, 1 to 19, like in schools, how we share? We have that here, like our kids. One can be having a sun pop or some kind of, or a drink and then pass it to the other child. Is it because of that kind of behavior and going out and everything?
Definitely. If you look at the age range, it definitely, a lot of questions, people asked about the immune system, but no, the immune system is very good. It has to do, it's linked to the behavior. From 0 to 5, they put anything in their mouth. So if there's an infected person in the house and they're coughing and sneezing, they're not washing their hands, they take toys and they put it into their mouth. And then we go to the primary schools. They share everything, a sound prop from someone's mouth to some, and then, they go and they put their mouth, and they drink water. Right, they put their mouth on the tap and then someone else comes and put their mouth. And then in high school, they share water bottles and cups and spoons. And, that's why in 2017 we had that outbreak in Thawadi. That's a boarding school. And this year we had it again at Navisau. It's another boarding school. Again, sharing age range, exposure, they're always living together. Right? So that's why, yeah.
Is it fair to say this disease also addresses hygiene in Fiji?
Yeah, definitely. It's just basically hygiene. Like I said, it has to come from someone who has the bacteria to someone else who doesn't have the bacteria. But, I must say that it's also in the literature, which is part of everyday life, that kissing, is also, because, again, it's transmission of the saliva. Through saliva. Right. And that's why, we have to be careful kissing our children and our loved ones. If someone is having the signs and symptoms, which we'll talk about later, you need to be very careful and get them to hospital.
Right. Okay. Thank you, Dr. Maisema. We're going to go for a quick break. You're on Speak Your Mind, and with us talking about the MENSI vaccination national campaign, which rolled out earlier this month. If you have any questions, please feel free to call us, 322-0906. We'll be back in a bit. Welcome back to Speak Your Mind. I'm Louisa Turang, and with us in studio, Dr. Anaseni Maisema, the Subdivisional Medical Officer, and we're talking about the MENSI vaccination immunization campaign that rolled out earlier this month. And we're talking about meningococcal, just on the behavior, because the age group is between babies to 19 years. Yes. So if you can just talk more about how this is spread or carried, and more about the bacteria.
The bacteria, right. Neisseria meningitidis, right. So hard to...
True, it's so... Can you repeat that again, please?
So the bacteria's name is Neisseria meningitidis. But, we must understand that meningitis can be caused by many other bacteria and virus. Right. But this is one severe form of it. And then, whenever someone is infected with Neisseria meningitidis, it's a red alert for us, from the station they presented to, and usually all these cases they come to our main hospitals because they're given antibiotics. The question is, okay, if we come, do you have treatment? We definitely have treatment. It's a bacteria, so it just needs antibiotics. And now we've made it available in all our subdivisional hospitals, all our provinces, including Rutuma. They all have subdivisional hospitals, and then you have the 3 main hospitals in the 3 cities, including 2 cities, including Labasa. They have this antibiotic. So if someone is having symptoms such as fever, and again, when the children or when the 18-year-olds, teenagers, when they're sick, they want to stay home, and they think it's a flu. Right. Because if you think about it, the adults, they just want to vomit. Some of them will vomit. They have headache. they have high fever, they might have a bit of body ache, and then some of them might have a bit of backache and stiff neck, and then other, as it progresses, some of them might have some rashes, red rashes. It begins with red rashes, and then in severe form, it turns purple. So the purple rashes are usually the danger sign. It's almost a critical sign for us. And for children, very subtle symptoms. They just don't want to eat. They're crying a lot. They're a bit sleepy than usual. Again, high fever. And if you think about it, these are just symptoms of flu and dengue, and might keep them at home because you think it's a flu. But that's what we're advising the public. If it's a high fever, too high, get them to hospital. So your nearest facility. And then our job in hospital is to differentiate whether it falls into the criteria of dengue or meningococcal disease, or is it a flu, and then we treat accordingly. And also we have some tests that, can help us diagnose these conditions very fast. But, and the WHO, the literature that they've studied, it mentions that the earlier the treatment, the lesser the chance of fatality.
Yeah. And how has that been? Like how do Fijians respond when when you put up the awareness and everything? Do they wait till the last minute to come and get checked, or ever since this scare, meningococcal scare?
No, actually, we've been, we're thankful to the public. It's obvious that, the people have been receiving, and they've been moved, and they're starting to understand how it's transmitted and what they can do to protect themselves. Because for the last 7 weeks, there hasn't been any case and no fatality, and it just means that it's not moving. If it's moving, it's probably places that, then we really need to study why is it moving in those areas. But in the obvious areas where it was starting, there was a cluster of cases in Navisau.
Right.
We came in, we controlled that, and, there hasn't been any case from there again. And then the whole of Fiji, there hasn't been any new cases that we needed to respond to. And most importantly is there hasn't been any deaths, because we don't want any deaths.
Right. No. So with the vaccination that rolled out earlier this month, that went to schools, and if you could just share more about that, the campaign launch and everything.
Okay, thank you. So, how do we prevent this disease?
Right.
And we've talked about how it's transmitted. So obviously to prevent it, you just need to stop it from getting from one person to another. So which means if you cough, you just need to back to primary school, hygiene classes, just need to use your handkerchief. And if you use your hands, you make sure you wash your hands appropriately with soap. And then sharing of utensils, kava, there's even mention of taki glasses when we are drinking alcohol, because that's a behavior in Fiji and within that age. It's found within our community. But so MenC vaccine, it protects specifically against this strain of Neisseria meningitidis. There's, I think, there's a lot of strains, 5 main ones. But the one that's causing the outbreak in Fiji is strain C. So this is specifically for Neisseria meningitidis strain C. That's why it's called MenC vaccine. And according to literature, it's safe and effective. And you have the UK, Canada, Australia. It's included in their schedule, immunization schedule. And our army officers, when they go abroad to countries, in African countries, which is most common, and they get this as routine immunization. So the other question asked, side effects. Any injection has side effects. Pain, swelling, and then some of them might not want to eat, and then they just want to sleep. And some of them might develop hives.
Right.
They just start to itch. Right. But the reassurance is we are ready. Yeah. Okay. We are ready for any reactions, severe reactions.
Yeah.
And any small reaction, they are coming to hospital. They are bringing to hospital.
Okay.
Just for reassurance.
Okay. So this is being administered in schools, right? And parents, we have to sign off on some kind of form. Who shouldn't have the vaccine? Like if my child has an allergy or has a high fever, can they still take that vaccine?
Right. So who shouldn't have the vaccine? Definitely one of the most common contraindication for this is just if you have fever.
Okay.
If you have fever, if your child has fever, definitely they shouldn't have it. And then allergy, again, then what are they allergic to? Because hardly you will be allergic to the antibiotic, but not the vaccine. So you really need to understand what are you allergic to.
Yeah.
But it's always safe to inform whoever is immunizing you. But you've asked, going to schools. Apparently, right now, all the subdivisional medical areas, again, all our provinces, including Rotuma, they now have their microplan. And included in the microplan is schedules on which schools are they visiting, And so that's being downloaded into our website. And also they can call their subdivisional medical officer or their hospitals, their local hospitals or health centers to get their schedule. And then also the schools have been informed, the consent forms have been taken, and then that needs to be under 18, all needs to be consented before the nurses actually come in and do the immunization.
Okay. Back to Dr. Maisema. We'll talk more about the microplan in a bit. You're on Speak Your Mind. We're going for a quick break. Welcome back to Speak Your Mind. With us in studio, Dr. Maisema, the Subdivisional Medical Officer, and we're talking about the Mensi vaccination, that the national campaign that rolled out earlier this month. Dr. Maisema, we're talking about the microplan. If you can share more about that. Okay,
so we've started the rollout in Central Division and Ra Province. Again, why Central and Ra? So 60% of the 58 this year are from Central. And then we had that outbreak in Navesa, which is included, within Ra Province. That's why the first rollout is in Central and in Ra Province. So the microplanning is, like I've mentioned, all the subdivisional medical areas, which is basically a subdivision medical area is a province. Yeah. And then we have Suva, Lotoka, and Lambasa, the Madota, that's a medical area. All the subdivisional medical areas, they have their microplan, and included in it is first schedules of where they're going. So we have 3 stations. The fixed stations are the schools. The child comes to school, and then we'll catch them in school. And then we have the mobile fixed, which are the villages. So we're also going visiting settlements. Some of our teams, they're going to schools up till 3 because the students, they knock off at 3. After that, they're visiting villages and settlements, and they're trying to catch, again, the 0 to 5, or those that are not in Kindi, and then the 18 and 19. And then we have the ones that are very far. One of the biggest concern, like Onui Lau and those up in the mountains, what if it's so far just to get to our nearest facility, a nursing station, to a health center.
Right.
But when we finish our school, and then when we finish the health center in this next 7 weeks, it's a 7 weeks program, and then it actually might extend, depending on the supply of vaccination or when it's arriving, the next batch of vaccination. But when it comes and when the schools are finished and we visited those villages, the nearby villages, then it'll be very clear which places, who hasn't come to us, how far are they, and we're going to try and get to them. But the Mensi, the reassurance is every 1 to 19, they are welcome. They are welcome to get their child, must be vaccinated. But again, it's on the prerogative of parents and 18 to 19-year-old who can make their own decisions.
Right, yeah.
And again, the most important thing is what we're trying to achieve, which is the herd immunity. For example, herd immunity is basically if in a village there are 1 to 19 years old. And then we come in because we want a 95 to 98% coverage. So we immunize 98% or 98 of the 1 to 19, which means we cover 98%. So if this Neisseria meningitidis or this bacteria comes into the village because somebody has it in their throat, because 98% of these high-risk people are covered with vaccine, then definitely this 1 to 19, they're not going to get it. They're going to protect the 2, and they're definitely going to protect the rest of the community. So that's basically the concept of herd immunity. That's why we're really begging and we're really asking. We're trying to reassure it's safe, it's protective, it protects, this vaccine, and for us to achieve that herd immunity.
Okay. How many children and adolescents have you vaccinated so far?
So we, in the first week, which was last week, after rollout, we have vaccinated 23,489 of our children. That's consented. That's from schools and also those that are coming to the health facilities. So one of the fixed stations are the health centers.
Right.
All the health facilities. So we also have teams in all the health facilities who are also immunizing. We have them in the schools, we have them going out to the villages and the communities, and we have teams in hospital who's also providing, those those are from 1 to 4 or before 5, and the 18, 19 of those that are not in school or the tertiary students. They get to the nearest health facility.
Okay. Just back to meningococcal with this. I was reading something. Just say you contracted and then you survived the disease. What are the long-term complications of this?
Thank you. So again, that's why we are saying it's serious.
Right.
When you say if it's anything involving the brain, because the brain is the most vital organ in our body. It controls everything. So literature, again, from WHO, I'm going to keep referring to WHO, it says that 50% of cases will die if they're not treated. So that's a 50% fatality. And even if it's treated well, I've mentioned we've got the antibiotics, we've got a good referral system. So if somebody is presenting up in the Mosi Highlands, we get them down to us, we get them to Navua. That's a good referral system, getting them, so they get the antibiotics. But even with all that good treatment, 10% to 15% will still die. And for those who survive, 20% will still have some disabilities, especially, involving the brain. So they have, again, quality of life.
Right.
Yeah. For small babies, they just crippled.
Right.
And then, because a lot of things, it just delays. They're almost delayed in terms of everything, talking, speech, social, mental, physical, again. So that's why to us, it's those things. One is dying, one is those. That's why we really want one treat, one we must prevent.
Right, prevent. So even with the vaccination rolled out, we still look at our behavior, our way of life. That's also very important. So I'm going to ask you something about the numbers you gave. So with the like for parents who don't consent to their children being immunized, how would you deal with these kind of parents? What are you doing? What's the ministry doing? Is it a big number? Have you noticed? Or
yeah, it's a significant number.
Okay.
Because we want 95 to 98%. Actually, the number comes to 333,000. Okay. Yeah, that's the number of individuals that we have to. And for these parents, maybe they just need a bit more information. So we're advising parents, come with your child to school if it's just scheduled date.
Right. And
then you ask questions because our nurses are ready to ask questions. They can call us on 157, which is our complaint, the toll-free line that people call to raise their concerns regarding any service.
Right.
And so they can ask their questions and we call them back to ask them. But for parents, like I've said, if you read on this vaccine, it's safe and it protects. And like I've mentioned, they use it in UK and Canada and Australia. And how useful is vaccine? We can, if you go back to 1870s, when there was a measles outbreak, 20,000, if 20% of Fiji's population, they succumbed from measles. And then, thank God, measles vaccine came in, and we have polio and rubella. So measles is hardly very rare because of the measles vaccines which our child are receiving at 1 year. And you hardly have rubella. Polio is almost eradicated from the world, from the country. It's almost eradicated from our country, I can say. And those are success stories of this
vaccine,
of vaccination programs. So this is just a vaccination, same as what our kids are already receiving. It's just a new bacteria that's that's causing this disease, this outbreak in our country. And of course, our job is to respond to it effectively and protect the community. And especially if you look at it, these are 1 to 19, they are at the tomorrow of Fiji. We need to protect them. And we need to make sure that 20% who are getting disabled, we need to prevent that from happening.
Okay. Thank you, Dr. Maisema. You're on Speak Your Mind. We'll be back in a bit. Welcome back to Speak Your Mind. With me in studio, Dr. Anna Saini Maisema, the Subdivisional Medical Officer, and we're talking about MenC, the immunization vaccination campaign that rolled out earlier this month. Just, Dr. Maisema, the side effects of this vaccine. If you can just talk more about that.
Right. So, that's again one of the concerns why a lot of parents, they refrain from, again, because they don't understand. That's why, we're thankful to FBC and all other stations for the opportunity. Yeah? So we have minor side effects, which are the pain on the injection site, and then there's a bit of swelling on the injection site. And hardly ever it gets infected because it usually just subsides after a few days. And then you have things like crying because of the pain. A child can be crying because of the pain. Right. They develop headache, vomiting, wanting to vomit. And then we have those that develop rash and a bit of itchiness, which might be the allergy. Yeah? But again, like I've mentioned, so for what we're doing, for those that have minor effects, we already have medications. So for all our children, for 20 minutes, we advise the teachers. So for 20 minutes, when they go back, they sit around just to make sure that no one is reacting. And if someone is reacting, they bring back to the nurses, and they have bays, but they are capped, and then they're given medications, or they're just observed in case there's some other signs coming that needs, they need referral to the hospitals. But for cases like hives, hives and they're itching, those ones are definitely, that's a straight referral, direct referral to the doctors, whether the doctors do their consultation and they do their examination, again, a bit of observation, and then usually parents have to come, and then we give them some reassurance and a bit of medication.
Okay. Yeah. Okay. So you haven't really had a really bad case, the reaction, bad
from
reaction.
last week till this week, we haven't had a bad reaction.
Okay. Okay. For pregnant women and for those breastfeeding, how safe is this?
Thank you. So definitely, you spoke about contraindication. There's no contraindication to breastfeeding women and to pregnant women. Okay. All 1 to 19 are welcome to get the vaccine.
It's safe, huh? Just on the program, how much is the cost of this whole exercise?
Right. So, and again, we're thankful to the government. It was advised, we saw the increase in numbers. We had to raise an alarm, and, that had to go up the hierarchy, and of course, from us to the government. And what was the prevention? Of course, that's the question. How do we protect the people? And that was one of through consultation, like I've mentioned. Vaccination was one of the best ways. Because again, the vaccination, it says it also decreases the number of bacteria in this 1 to 19, and then it actually reduces the chance of transmission. With all those literature review and all those advice that's coming from other partners, of health, so the government gave actually $10 million. This is a $10 million program. Our nurses are working day in, day out.
Right.
And we've had, for example, in Navo, we've got 2 soldiers there who are driving for us. Right. Living in Navo, they're driving for the nurses because we have to make sure we're going up Namosi, we are crossing to Banga and Nutha, and that's just for us, Sarah and Namosi. But then you've got in Central Division, you've got Naitasiri, Rewa, Tailevu, and then you've got the Great Suva Nausori area, and then Ra, which is big geographically. We have to make sure we reach every school, every village.
Okay. So right now the vaccination is free, administered in schools and everything. If you were to go, for how much would it normally cost?
So the normal cost, there's a task force. When this outbreak came, there was a task force that was formed. And through the help of UNICEF and the Australian, I think it was DFAT, which is a branch of AusAid. Right. Yeah, they helped in the purchase. And UNICEF actually helped in the arrangement. It actually cost $150.
You Fijian or US or?
It's Fijian. It's
Oh,
not US. Yeah, I just confirmed.
150.
Yeah.
Okay.
And then because of consultation, and they actually, they reduced it to $9 per vial. Because one vial per person, it's a pre-filled. So the syringe has the medicine. We only put the needle and then we inject, and then those needles, they go into a safe, safe container.
So otherwise, you'll be paying $150.
Otherwise, you'll be paying $150.
Sure.
We also have it available. I've heard that
At
some
some
retail pharmacies, they now are selling it.
Okay.
And I think it's ranging from, first I heard it was $150, but I think it's lately I've heard $200 to $250 for one vial, for one dose of vaccine.
One vial. So there you heard it. If you haven't consented to your child being vaccinated, please know that it costs $150. And they need to get vaccinated because it can save your child's life as well as yours and everybody else at home. So if you can just, if I'm vaccinated or my child is vaccinated, is there a chance that I can still develop the disease?
Okay, so MenC, what I've said, this is specifically for strain C.
Right.
Right now, there is no vaccine that protects you from all the strains of Neisseria.
There's no vaccine?
No.
Okay.
So this is specifically for MenC.
Okay.
And like I've mentioned, there are other bacteria that cause meningitis. But for this MenC, it protects you for your child for 5 years. It protects the child for the next 5 years.
Okay. Okay. Can you explain, is there a relationship between meningococcal and pneumonia?
One, the relationship is they're both infections.
Okay.
So when we hear meningococcal, so the covering of the brain is called the meninges.
Okay, yeah.
So that's where the meningo part of that name came from.
Okay.
And the coccal is basically the shape of the bacteria. When you look through a microscope, it's circles and they live in two diplococci. That's what the microbiologists say. So the meningococcal is basically meninges specifically. That's a covering of the brain, and coccal is referring to the shape of the disease. But pneumonia, again, that's infection of the lungs.
Right. Yeah. Okay. Thank you, Dr. Maisema. We're going to be back in a bit. You're on Speak Your Mind. Welcome back to Speak Your Mind. We have Dr. Maisema, the Subdivisional Medical Officer. We're talking about the immunization, MenC vaccination that rolled out earlier this month. I still have problems pronouncing the... Lucky they chopped it down to MenC. But just if my child has missed out in school and being immunized, how else can they, as parents, where can they go?
So, thank you very much for that question. So if your child has missed out because your child was sick and maybe you needed to make that decision later on. Right. Like I've said, one of the fixed stations is the health centers. All health centers and all the nursing stations, they are open for vaccination. So right now we have the MenC vaccine present in all the health facilities, which means the hospitals, the health centers, and nursing stations right now within Central Division and in Ra Province. So if you've missed out in school, please feel free either to find, if you meet them in the communities, get your child vaccinated there, or you can bring them to the health facilities, because in the health facilities, it's every day.
Okay. Another problem we have here in Fiji, when someone is sick, the first thing they do, or go outside, go and get the wambasudu and all this. This is the Fijian, they prefer the herbal, more traditional medicines. So, what's the danger? We all know it's not really good, but if you can just talk more about why we need to take ourselves to the doctor and not rely on this.
Like I've mentioned, it's clearly documented that if we give early treatment, then we decrease the chance of fatality. And like I've mentioned, even if it's treated well, 20% will get disabilities and 10% will still die. So one of the risks you're taking when that happens is you're just taking a bit of time. You're taking a bit of time. You're delaying the time of presenting to the hospital and for them to get that antibiotic. Like I've said, This is a bacteria. It needs antibiotic. Antibiotic are basically antibacteria. They're medications to kill bacteria. So there's a antibiotic specifically, available for MenC. And, the reassurance is now we've made it available to all subdivisional hospitals. So if someone from somewhere is getting sick, they get to the nearest nursing station. That's communicated down to us. That's discussed. We get them down. If they meet the criteria, that's from us straight to CWM. We give the first dose of antibiotic from the subdivisional hospital, and before they get the rest from in the referral hospital, which are Lambasa, Suva, and Lautoka. So basically, those things might improve maybe your immunity, but you need that antibiotic, and that antibiotic needs to get into the system as fast as you can to help your body fight the bacteria.
Okay, so I think the important thing here is going to a doctor at the earliest, because even if it's not MenC, like in your child, they can pick up what else your child is suffering from and address it right there and then. So please, you're not a doctor. Take your child to the doctor. We're wrapping things up shortly. If you'd like to, add anything else that on MenC and the vaccination program.
I think, so the objective again of this vaccination program is one, we must protect those who are getting diseased. And like I've said, out of the 58 cases we've had this year, they're all 1 to 19. So it's obvious that they are the ones getting sick.
Right.
And we've talked about behavior.
Right.
There are probably other predisposing factors to why they're getting it. But let's stick to what we have. It's the 1 to 19.
Right.
The second one is we need to protect those that are dying of the disease. And I've mentioned it's the 0 to 5. And we've had 4 deaths this year. And so we need to protect those ones who are more at risk.
1 to 5. So the parents, we're talking to parents.
5, So 1 to 5 are getting immunized. And again, parents. The third one is to stop, or we just need to stop the transmission of Neisseria meningitis, which is this bacteria. We need to stop the transmission from one person to another. One of these prevention strategies which is the expensive strategy, is vaccination. We've mentioned it's $10 million. But the cost of one life to a family is more than $10 million. That's why we must protect. But again, the easiest way and the most economical way is just, if you're coughing, use a handkerchief. And I've also always mentioned, if you don't have a handkerchief, just cough into your top.
Do the dab.
Yeah, do the dab. Or you just, you're going to cough into your hand.
Right.
Just make sure that you wash your hands again. So availability of soap everywhere.
Right.
And then if you are exposed to somebody who's diseased, make sure you are not sharing any eating utensils.
Kissing, what to do.
That's always been the joke in this class. So either you pack or either you sniff like the grandmothers do. But be careful, we must understand it's found in saliva. So that's how it's transmitted. We stop the transmission.
Blow kiss.
Yeah, or just blow kiss and then they just receive the kiss. But because at the end of the end of that is you want to make sure, because you're going to get more kisses after that.
True, you're alive to get more kisses.
Yeah. So, and MenC, it protects, it's safe. We are ready to receive you. We are ready for any reaction. All 1 to 19 must get it. And we must achieve the herd immunity, which is 95 to 98%.
Right.
And if for some reason we're not reaching you, please call us 157. Our headquarters number is 331-3444. That's CWM. And our headquarters is 3306177. Call us, raise your concerns, and we'll be happy.
Online, can they reach you on Facebook?
Online also, thank you. Online also, you can raise a comment, send us a message. We have the MLOs, media relation officers, and the team who are always responding online.
Okay. Yeah. Thank you. Thank you, Dr. Maisema, for being here today. I certainly learned a lot. Yes. And yes, if your child isn't immunized yet, please make that a priority to get your child or your children immunized with the MenC vaccination that's currently being administered at schools. And if you, like she mentioned, if you've missed out on that, you can always visit your nearest health center. I'm Louisa Toranga. It's been really good being with you today on Speak Your Mind. We'll talk soon.